Dr. Bymaster, do you want to introduce yourself?
Sure. I'm Dr. Bymaster, and I currently work in a small community clinic in the middle of San Jose, working with low-income, mostly Spanish-speaking patients. I am originally from Oregon, went to medical school in Iowa, and residency at O'Connor Hospital here in town in San Jose.
And then Dr. Ho, do you want to introduce yourself?
Hi, I am Cheryl Ho, and I'm a physician, and I practiced in San Jose, California for Valley Medical Center. I know that it was advertised that I am a clinical assistant professor at Stanford, and so in my work at Valley Medical Center, we do some work with Stanford residents and medical students. I went to medical school in UC San Diego, did my undergraduate at Stanford, and now I'm in faculty at VMC.
All right, Tom, you're up.
All right, I'm Tom Stafford. I'm a member of the board of directors for the Healing Grove, proudly. I work in Rockland, California at the Tenur Medical Group. I did my residency training in internal medicine and pediatrics at USC and LA County Hospital. I went to medical school at Tufts University in Boston, and I'm happy to be here with you guys today.
And I hear we are live now on Facebook, and I see it. So we're good to go.
Great. Okay, we figured it out apparently. Fantastic. Okay, well, we will dive in with our presentation. So let me get that started for us here. Okay, well, I'll introduce myself. So my name is Brett Bymaster. I'm Executive Director of Healing Grove Health Center. So let me say just really quick what Healing Grove Health Center is. So Healing Grove Health Center is a new organization that's bringing Christian healthcare to the Valley. And we're trying to change the paradigm from just visiting the doctor to actually achieving holistic wellness. And we think that we can do that through place-based community care. In other words, caring for an individual community, as well as faith-based community care, that the transformation from visiting the doctor to achieving wellness is through the path of Jesus. And so our mission is to share the love of Jesus through healthcare, soul care, and culture care in order to bring the healing of the nations to our community and the world beyond. So if you want to keep up with us, you can check us out at healinggrove.org/coronavirus, and we're doing daily updates there. And Dr. Bymaster shared a really interesting article there yesterday, so check that out and keep up to date. If you have a question, I encourage you to go ahead and type it in on the Q&A section in Zoom, or if you're on Facebook, you can just put a comment there. We'd love to get your questions, and we'll have more Q&A time at the end. So go ahead and type your Q&A question in now so that you don't forget by the end, okay? So I'm gonna go ahead and, well, just overview of what we're gonna do. We're gonna talk about epidemiology and transmission. We're gonna talk about prevention. Dr. Bymaster is gonna talk about clinical features, and then we're gonna talk about how as Christians we can respond to this. So with that, I'm gonna go ahead and turn it over to Dr. Cheryl Ho. Go ahead, Dr. Cheryl.
Hi, so I know we did some introductions, and that was me. And so what I'm going to focus on are really what's called the epidemiology and transmission. So these are fancy words for the statistics and numbers behind the disease. So I just want to set a framework of coronavirus. I know that there's been a lot in the news, and a lot of people are extremely worried. And, you know, it is a very serious condition, but I also want to just compare coronavirus to the flu. So if we look at so far at the number of deaths that the flu causes, which I think we're all familiar with, we see that worldwide there are 300,000 to 600,000 deaths annually from the seasonal flu. In the US alone this year, we've already seen 20,000 deaths just in this flu season alone. And, you know, if you compare that to the worldwide death rate of coronavirus, we're just barely surfacing over 4,000 or a little bit more. So in terms of the scope of the problem of coronavirus at this point, it's really orders of magnitude different in terms of the numbers of death. I want to just emphasize throughout this presentation that we should not panic. I think if you want to talk numbers in terms of death rates, in terms of the percentage of people that die from seasonal flu or influenza, that death rate is actually 0.1% of people who actually get influenza. And then on the other extreme, I want to share about the 1918 pandemic, which was called the Spanish flu, right around the time of World War I. And that was a large pandemic that caused large casualties here all over the world, San Jose, San Francisco, and that death rate was greater than 2.5%. And so the question is, where does coronavirus fit in these deaths rates? And to be honest, I think this number is changing on pretty much a weekly or daily basis. The higher numbers that we've seen, which are closer to 2% death rate, were coming out of China, where the coronavirus or COVID-19 first originated. But we are now starting to see in South Korea and places outside of China that the death rate is closer to 0.6%. And part of this is that, a lot of this is around the statistics. So the denominator in this is the number of total people infected, and then the top number, which is the numerator, is the people that died. So for example, in South Korea, we are seeing closer to 0.6%, and that is because people are being tested by the masses. So you're getting about 10,000 tests per day. And so what we're seeing is that many more people have the disease than actually are dying from it. And as we start to test and test more in the United States, I actually think that this death rate estimate will be coming down because we are not capturing the total number of disease right now. So if you look at the percentage population, very low. Comparing influenza to coronavirus, so influenza hits older people, and similarly, coronavirus also hits older people. These are the ones that are getting the complications. We see a slightly higher rate in men than women, but what we're also seeing, which is quite surprising about the coronavirus, is that children are generally getting less severe disease or no disease at all. One of the questions is, who do we need to protect? Who is at risk for coronavirus? And as I mentioned, it's all about the age. So if you look there, this is kind of our latest breakdown of what we know about who is dying from coronavirus. So if you are over the age of 80, your risk of dying is over 20%, 70 at 80%, at 8%. And so recently there was at least in Santa Clara County, there was a warning about people over the age of 50. And that's because at the age, which I, to be honest, don't consider that old, but over the age of 50, the mortality rate we are seeing at about 1.3%, but quite low in comparison to those that are over 80. How is it transmitted? So it is presumed, and like most other coronaviruses, presumed to be by what's called respiratory droplet. And so as we see the person sneezing, that is how it's presumed to be passed. We say presumed because that's the most likely form. There are things that we just don't know about the coronavirus. There are specimens that can be seen in stool and blood, but we are not convinced necessarily, or nor do we know that they are passed in that way. And what we do know is that people with and without symptoms can transmit the virus. And that is, I think, what is worrying and concerning most for much of the population now. In terms of incubation period, I think we've heard the days 14 days a lot in the media. And that's because that's a very conservative estimate of when it is safe after exposure. And so that's presumed to be the incubation period. But in all truth, most of the cases are appearing about 5 days after exposure. There's this fancy term in epidemiology called R0, which basically is a fancy term to mean the average number of people who will become sick from one infected individual. And so again, just to put COVID-19 into context, the seasonal flu, for every one person that is sick, about 1.5 people will get sick from that one person. SARS had a little higher rate of 2 to 5, and coronavirus or COVID-19 has an R0 of about 2 to 3. So a little bit higher than seasonal flu, but by no means in comparison to measles, which is, these are the ones that were getting infected in Disneyland, and that is an R0 of 12 to 16. So just in a nutshell, I really want to emphasize to everyone that this is a marathon and not a sprint. I think we are behaving in our country like this is a sprint and we just have to get over the next 4 weeks. But to be honest, this is likely going to be something that we're going to be dealing with for quite a bit of time. I want to just summarize that there are fewer deaths overall from coronavirus than there have been from influenza this season. The death rate is slightly higher, but not dramatically higher than those with influenza, but it is more so in those that are older and with chronic illnesses. And the other final point that I made is that it's more contagious than the flu, but less than SARS or measles. And I just want to bring this point. I just think it's a little ironic. So on the bottom right-hand corner is an electron microscopy picture of the coronavirus. So if you see, the reason it's called corona is because it looks like a crown. And so the middle picture there is a crown. And it just begs the question, for those who are Christ followers in this season, who is your king? And that is, I think, to me, kind of the underlying question in all this. Is your king going to be fear? Or is your king the Lord Jesus Christ? And I was just reminded the other day that in the midst of this trial, how are we taking this trial? Is it one that is bringing joy? So in James 1, it says, "Consider it pure joy, my brothers and sisters, whenever you face trials of many kinds, because you know the testing of your faith produces perseverance." And so my question to Christ followers are, as hard as it is, are you experiencing the joy of Christ? And I think as Christ followers, what is most important in this time is really our response as Christians. And we'll talk more about this later in the webinar.
Okay, thanks, Cheryl. So I'm Dr. Tom Stafford, and these are the credentials I mentioned earlier. I'm a pediatrician and an internist, and I practice in Rockland, California. So next slide. So I'm going to talk about prevention. Next slide. So one of my favorite things so far about the coronavirus is all of the jokes going around on Facebook. And my family is particularly good at sending these around. So I wanted to share a couple of them. This one, you can all see it on your screen, but it's a picture from the year 2060. And a grandkid asks his grandma to tell him the story of coronavirus. And she walks into the garage and she's still got a huge mound of toilet paper stashed in her garage. And then next slide. I love this one. I got this one today. It says, "Some people aren't shaking hands because of the coronavirus. I'm not shaking hands because everyone is out of toilet paper." All right, next slide. So as far as protecting yourself, a lot of this has gone around. I don't need to share things that have been said over and over and over in the media and that you've already seen. I'll touch upon those things really briefly. There are a couple of things that I haven't been seeing. One is just stressing the things that boost immunity in general. So there was a good study relatively recently of 150 people out at, it was done at UC San Francisco, and the people, half of the people slept for less than 6 hours a night, and the other half of the people were allowed to sleep between 7.5 and 8 hours per night. And the chief investigator actually squirted rhinovirus, the cold virus, in their nose. So they had a direct inoculation of rhinovirus in their nose. And the group of people who were sleeping 7.5 to 8 hours at night were 30% less likely to actually contract that rhinovirus. So we are a chronically sleep-deprived society. And I think as Christians, at least myself as a Christian, I've stewarded my sleep very poorly. So one way you can significantly protect yourself from any illness, including coronavirus, is to get a good night's sleep every night. That meaning 7.5 to 8 hours or more. Other ways to boost your immunity: stress reduction, regular exercise, healthy eating. These are all basic principles. And yes, I am saying we should sleep like dogs. I love that comment. So other things everybody knows: wash your hands frequently, particularly if you touch something that other people touch frequently: doorknobs, cabinet handles. Soap and water is the best thing. Washing your hands for 20 seconds, which is really hard to do. I've tried it. 20 seconds is a long time. A hand sanitizer with greater than 60% ethanol or ethyl alcohol, which are most hand sanitizers, is a good alternative. We had a great question last time we did a similar presentation to this about baby Ganex. And there's a lot of different products out there that just use benzalkonium chloride as the antimicrobial agent. And that is not recommended for coronavirus. It hasn't been shown to be as effective as ethyl alcohol. So be careful. There's a lot of hand sanitizers out there and hand sanitizing products out there where that's the active ingredient. And that's usually okay and good, but in this instance, we want to use the stuff that we know works. Another funny Facebook post, wash your hands like you've been chopping jalapenos and you have to remove your contact lenses. I think I would spend about 20 seconds washing my hands there. As far as protecting yourself goes and cleaning surfaces, the EPA has a really good list that I just found the other day, and they're all products that are approved and known to kill coronavirus. The website is listed there. It's kind of complicated, but if you just Google EPA and coronavirus, it will show up towards the top. As far as travel goes, the CDC updates this regularly. As of now, the only strict recommendations are to avoid non-essential travel to China and Iran, also South Korea, Italy, and Japan. And that's easy to find on the CDC website, and they'll update that. So it's important to talk about masks because there's a lot of misunderstandings about masks. It's not all that complicated. There's no need to wear an N95 respirator mask. That's the one on the bottom right there. Those N95 respirators protect against viruses that are spread through respiratory means, whereas the coronavirus is predominantly droplets. The only time that you would need to wear a mask, however, is if you yourself are sick to protect other people, or if you are close to actively caring for somebody who has coronavirus. Otherwise, when you're out and about in the community, there's really no reason to just wear a mask. Next slide. As far as protecting others goes, the Santa Clara Public Health Department is putting regular updates on their website, and they have recommended starting 12 a.m. on March 11th for 3 weeks. I guess it's a legal order that there should be no mass gatherings of greater than 1,000 people, all in the same room. So that doesn't mean that you should cancel church. If your church has more than 1,000 attendees, you can be creative, see if you can have extra services, use multiple rooms. We just don't want to have more than 1,000 people in one room or one place. Next slide. I found this information interesting, and I haven't seen it out there much. As far as the coronavirus itself and how long it can live on surfaces, it's really quite variable. It depends on temperature, humidity, so there's no hard and fast answer to this. It also probably lasts longer on hard surfaces than soft surfaces like clothes and pillows, although those things are able to harbor the virus. So there's just a list here. Lasts longest on metal, plastic, ceramics, 5 days. Less time on latex or aluminum, and that slide is pretty straightforward.
All right, thank you, Tom. So here's me. I am a family doctor, and I already talked about where I train. Okay, so I'm going to talk about clinical features, testing, and treatment. Always, always, always important to make sure you get your information from the right sources. We are an excellent source. We get we are always checking the CDC website, and I almost call the public health department every single day because I have a new question or a patient or something to talk about. So coronavirus, it looks like just about everything else we see in the winter: fever, cough, shortness of breath. Most of the cases are mild. So that means, it doesn't have to have fever. It doesn't have to have cough. It's amazing. Like, you could have it with very mild symptoms. The second week, we're learning, is possibly more severe than the first week, which is a little bit unusual. So this would be an illness that starts out somewhat mild and can progress to a little bit more difficult that second week. Obviously, as we've mentioned, people who are elderly, have compromised immune systems or chronic diseases, anyone who has any kind of medical frailty is going to be more affected than those who are young and healthy. And then males greater than females, we don't completely know why, but it also may be partially related to smoking patterns in populations where sometimes males are more likely to smoke, and that of course puts you at greater risk of a respiratory infection. Okay, diagnosis. We're going to talk about the test in the next couple slides. I have a lot to say about the test. And then I'm going to talk a little about management, meaning like what do we do if we have the coronavirus? Most people have to stay home and have a lot of chicken soup. There isn't a cure, there's not a vaccine, although these things are both in production. Very encouraging data out there from some early clinical trials already happening for both a medicine and a vaccine. And so right now it's supportive treatment, it's fluids, rest, Tylenol, ibuprofen, chicken soup. So testing. Okay, here's the deal about testing. We in the United States were not able to get our act together so that we could get tests into the hands of people on the ground in a big way. So we have a few tests that are coming from the CDC to health departments. That the tests, because we have so few, are being rationed, and they're saved for the most sick people, the most high-risk people, the people who they're really worried about. And so people who are regular people with maybe milder illness, maybe don't need to be hospitalized, likely to survive it at home with their chicken soup, those people don't get tested by the health department as of now. We're really hoping that the CDC will produce more tests and allow this to be more possible to test like a larger body of people very soon. But so far, that's where we're at. Quest and LabCorp got testing approved, which is fabulous. So I am able to order tests at Quest. However, I was super excited about doing that this week. And in fact, today I was all ready to test somebody at Quest, and we didn't have the right media to send it to them, and we don't have the right test code, and and it actually costs some money if you don't have insurance. And so anyway, it was kind of a deal that didn't work out for us to test it. So we did order tests. I think a lot of clinics are in the space of trying to order the correct supplies to do the tests. And so I predict that in sometime next week, we're going to have a lot of tests go through the private lab companies. And we will suddenly have a way better idea of how many people in the community have coronavirus, which will be extremely helpful for us to just know exactly what we're dealing with here. Shout out to South Korea and Singapore, who really did have their act together. Good job, guys. And they actually tested a lot of people, which really just helps you know your denominator, helps you know what the death rate is, helps you know like who do you need to quarantine, helps you know like is it a good idea to close schools, and all of these kinds of questions that we all have. And so yeah, I'm really waiting for that. Stanford also made their own test, and so they're testing in-house, which is also really great. And so just if the CDC's listening next time and the FDA, let's just let everybody do their own tests because that will make it go faster. Okay, anyways, a little bit of politics. So these are all reverse transcriptase PCR tests for the nerds out there. So we're just looking at the viral RNA, if it's there or not. If you're sick, stay home, eat your chicken soup. If you have a moderate illness, stay home and watch for any signs of worsening. And we really, really, really are looking for those really persistent fevers, that severe cough, and especially the shortness of breath if you just feel like you can't get air. It's normal if you're having a big coughing fit to feel like you can't breathe in that like second of the coughing fit. So that's not what we mean. What we mean is if you're having just trouble breathing in general, like you just can't move enough air, then please go to the hospital or call your doctor. If you are a Healing Grove patient, you can just call us anytime, and we're happy to talk through it with you. If you have a severe illness, go to the hospital. I want to talk briefly about the 1918 pandemic because a lot of people are thinking about that. This is the Spanish flu, and I have a great history book about San Jose and exactly what happened here in San Jose during the 1918 pandemic. And let me just tell you, this is not the same as the 1918 pandemic at all. It was like the minute that they noticed that it had come to San Jose, it was the beginning of October 1918, And immediately the health department shut down schools, churches, everything. And immediately people were dying. They had 7 dead in a day. The first day that they declared this is a problem, hospitals were overrun with people. They were people in the chapels and in the living quarters of the nuns who were running O'Connor. And there were 50 people coming from Santa Clara University who were stricken with the influenza at that time. Doctors were having to see 500 patients a day because it was just everywhere. And people were dying within days. They would, young, healthy people, football players for Santa Clara University would get a fever. 3 days later, they're dead. It was really, really, really scary. And it was really highly infectious, highly fatal. And so within a month or so, about 200 people were dead. And I mean, San Jose was better off than most places because people got together and worked on it. But I just want to let everybody know, we're not seeing that same kind of virulence here. It is, it's important to worry about. It's important to wash your hands, but this is not 1918.
And thank God for that. So my name is Brett Bymaster. I'm the executive director again of Healing Grove. And so I want to talk about how we can think about this as Christians. When I look at how we're responding to coronavirus in the community, the word that I would use is panic or fear, hoarding, like these really extreme responses. And if you look at the data, like Dr. Bymaster was just showing, the data doesn't feel like it matches with that. So I think there's a great chance for us as Christians to really live into the peace of Jesus. Jesus said, "Peace I leave with you, my peace I give to you." And so I think there's this great chance for us to go out in our communities and not be troubled and not be afraid, because we know that we have eternal life in Jesus. And that's just such a great promise. And I think we need to be the peace to our neighbors and our communities. The second thing I think we need to think about as respond to coronavirus is the way Jesus responded to contagious diseases. So here I have a photo of a man that's suffering with leprosy. Leprosy is really cheap and easy to cure today. Tragically, there's still a large number of people with leprosy because they're too poor to afford the $100 it costs to treat it. Angie and I have actually been to a leper colony in Africa, and it's heartbreaking. Jesus' first response in Luke 5, when he saw a leper, was to reach out his hand and touch the man. And I think it's so interesting that Jesus touched the man first and healed him second. And I think that is a sense to which Jesus had no fear of the disease, and even more so how Jesus wanted to touch this man in his state of disease. I think that's a beautiful call for us as Christians to go out in the community without fear and to be willing to touch the sick. When Jesus healed the paralytic coming through the ceiling, he healed this man for a specific purpose. He said, "I want you to know that the Son of Man has authority on earth to forgive sins." And so I think there's an opportunity for us to think about how do we go out in the community and help people that are dealing with sickness and disease so that we can show that Jesus has authority to forgive, authority on earth to forgive sins. And third, I think it's really important that we respond not out of fear, but of power and love and self-control. And I think what that looks like is in our prayers and in our thoughts, we need to spend more time praying for boldness than we do for safety. When the apostles got out of prison, the first thing they did was not to pray that they wouldn't go back to prison. The first thing they did was pray for boldness. And so I think there's a real opportunity here for us to pray for boldness. So some examples of people who have done this in the past: the Alexian brothers were an order that began in Belgium during the Black Plagues in the 1400s, which wiped out hundreds of millions of people, like decimated a third of the population of Europe, which didn't recover for 300 or 400 years. And the Alexian brothers' first response to the Black Plague, they were sending people out of the community, out on the edge of town to die. And instead of running away from the sick, the Alexian brothers ran towards the sick. And that is where we got the Alexian Brothers Hospital here in San Jose, which became Regional Medical Center. And I think it's a great example of Christians who respond without fear and with power and love and self-control. Another good example is our friend, Dr. John Fankhauser, who is the former Chief Medical Officer of Valley Medical, as well as Mara Dorado, both of whom went to Liberia during the Ebola crisis. We think that coronavirus might have somewhere between 0.6 and 2% death rate. In Africa at that time, Ebola was having as high as 80% death rate. And these two people went and served, even though the risk was so high, which is really out of their desire to serve Jesus and out of their knowledge that even if they did die, that their eternal life with Jesus was set, which I think is a beautiful response. So I want to just share really briefly a little bit about Healing Grove Health Center, and then we'll go to Q&A. To do that, I want to share just a quick 2-minute video. So if you can just watch this with me. This video is with a young lady named Kathy. And I think this video shows why we want to do Healing Grove Health Center, why there's a need for this. So tell me your name.
My name is Kathy Barajas.
And how old are you, Kathy?
I am 18.
Great. So you're a senior in high school now. Tell me about your family situation. Tell me about why you might be interested in becoming a Healing Grove member.
I come from a family of immigrants. My mom is an immigrant and she immigrated here 18 years ago. Due to her status, she is not able to, receive health care. And so whenever she suffers from injuries or, is ill, she's not able to go receive the kind of care that she needs to get better. And I think Healing Grove is a really good opportunity for her to finally receive that healing that, we've longed for so long.
And what kind of medical care does your mom need? What challenges does she face?
I think due to her job, my mom is, she washes dishes throughout the week at a restaurant, and on weekends she cleans houses. Those are very, physically consuming jobs, and I think a lot of times the kind of pain that she has to face isn't really addressed. She has faced several injuries. She's fallen a couple times. Actually remembering one time she received a chemical burn from the dish soap in her hands, and there wasn't much we could do about it. A lot of the time she has joint problems, so she kind of just has to work through the pain.
Oh, that's tough. And so when she does get injured now, where does she go?
Nowhere. We kind of just gotta deal with that at home.
And so how do you think Healing Grove would be able to change her life?
I think she'll finally be able to get the care that she deserves. Everyone deserves health care, I think, and her inability to get it actually, I think, just keeps her from being able to, just thrive.
So Healing Grove Health Center's mission is to look at what it requires to provide really high quality healthcare to low-income uninsured folks in our community. The way we do that is we offer memberships to people who have means, who have insurance. Those memberships cost about $200 a month. And each person that pays for a membership funds 2 low-income people to be able to access our clinic. And with that membership, you get unlimited primary care. You get the personal cell phone of your doctor. You get personalized care. You get same-day appointments. You get that relationship with your doctor. Most importantly, you get spiritual Christian care from your physician, which now that O'Connor Hospital closed, there is no Christian healthcare in Silicon Valley. And so we think this is a great way for you to engage both in sharing the love of Jesus with our lower income friends and neighbors, as well as getting great healthcare yourself. So we love to partner. So if you have a church or if you're interested in volunteering, please talk to us. We'd love to partner with you. We'd love to do prayer ministry. We'd love to get you involved in what we're doing. I should note that there's one person not on this call. That's Lourdes Sarmiento, who is our Spanish-speaking staff pastor. And if you know Lourdes, she is amazing. So we just signed a lease on a 4,500 square foot space. It's a really large space. And we are looking at building that space out. So we're doing a capital campaign for that. And so I want to invite you this Saturday to join us at 10 a.m. We're going to be at the space. We just signed the lease. We just got the keys. So you can join us at 10 o'clock. We're going to have a big load of Sharpies. And we're going to be out there literally writing our prayers in the wall. We're going to be blessing this space and claiming it for Jesus. And I think, this is a space where we're going to see a lot of healing. We're going to see a lot of life change. We're going to see miracles. And I think if we want that, we have to prepare the space by blessing it in prayer. So I'd really like to invite you to come out 10 o'clock this Saturday, 226 West Alma. And you can come out and write your prayers in the walls. And what's cool is then in 5 or 10 years when Healing Grove is thriving, you'll be able to drive by and say, hey, my prayers are literally in the walls. If you'd like to contribute, like I said, we're working on raising money for our capital campaign to finish the construction, and we would love to have you contribute. So with that, we're going to go to Q&A. I see that there's already several good questions that have been asked. Let's see. There was a really good question here. One of you guys, yeah.
Okay, so great question about if coronavirus follows a hepatitis B type pattern of illness, so that it would linger and come back even after you start feeling better after medication. And the only solution is a vaccine. So I think the question is, does the virus become a chronic disease, or is it something that would actually go away after the 2 weeks or so that the illness lasts? So I don't know if Cheryl or Tom want to answer this. My understanding is that second week can be worse than the first week, which is very unusual for, it's not what we're used to for a regular cold. And so people were worried that there was a worsening of the illness. But I haven't seen anything that suggests that it becomes chronic like a hepatitis B can.
Yeah, that's right. I haven't heard that either. I think what we know about other coronaviruses, and there are other coronaviruses out there that are not COVID-19, it's just an acute illness.
Yeah, I agree. So the incubation period can be anywhere from a couple of days to about 14 days. So you can be an asymptomatic carrier for a little while. And then for the more severe infections, you can be infected for a long time, like up to 6 weeks. But as far as having that chronic carrier state, I'm not aware that that is the case and have not seen anything about that.
All right. Okay, question about avoiding foods. Okay, this is a great question. A lot of people, in times of things that feel really out of control, we think like, well, what can we do to help prevent illness? And this is a great question for Tom, because he was talking about prevention. And so the question is, what food should we avoid? Should we avoid sugar? Should we aim for certain types of foods?
Yeah, so I'll let you guys answer as well. In general, following a healthy diet that is generally known to be healthy and good for immunity and long-term cardiovascular health would be what I would recommend. And that's a diet that is low in sugar, particularly low in refined sugar. Sugar does tend to be pro-inflammatory. It's hard on your pancreas. It's hard on your blood vessels. So there's a lot of reasons to avoid refined sugar and refined carbohydrates in general. So I would recommend that as a general principle. And then eating a healthy diet that's full of colorful vegetables, dark green vegetables is great for your immune system. I don't know if you guys have anything to add to that.
Yeah, I think I will say that we don't have a lot of good randomized controlled trials that show data on the effect of specific diet in terms of actual outcomes. I think we have a lot of good thoughts, I think, as Dr. Stafford mentioned, of really what is healthy and what is not. But in terms of like the large scale randomized trials, we don't. And so I think, we just use our common sense. And I think sometimes we can be, quite maybe specific or particular about recommendations, but to be honest, the medical literature has not fully borne that out yet.
Yep, I agree. And always variety of foods, but especially high in the fruits and vegetables, always good. There's so many vitamins, there's so much fiber, there's so many cofactors, and all those things are going to be really important for your immune system's healthy functioning. So you're exactly right. You're on the right track. Always the answer is plant-based foods, right?
And more water.
And water, and exercise, and sleep. Okay. Next question. Should we do this one?
Yeah, so Jorg asked, if you go to the health department, how they do to find if needed in order for you to get a test there.
Yeah, I can take this one. Me and the health department are buddies. I had a patient just today who had a fever and cough and possibly coronavirus, and I really wanted to test this patient. This patient was uninsured, and it costs about $200 to just go to Quest if you're paying out of pocket. So I said, oh, well, let's go to the health department. So I called up the health department, and the health department asked their series of questions. They really only have a certain number of tests right now, and they have to save them for the most critical patients. So their question is the patient in the hospital? Is the patient a healthcare provider who's caring for a coronavirus patient? Is the patient in a nursing home? Is the patient connected with a known COVID, patient? And the answer to all of those was no. And so they said, we can't test the person at this time. Is the patient very elderly or frail or whatever? And it was a otherwise healthy patient who's about my age, and so very young. Just kidding. I had to call the patient and say, I'm sorry, we can't test you unless you want to pay an arm and a leg. And so we're just going to watch and wait and hope. But like I said, I really hope soon we'll have more tests and we won't be rationing them, because I really want to know if that patient has it. Then we need to advise that person to stay home, right? We need to advise that person also for their kids to, not go to school or whatever. So anyway, there's a lot there.
Yeah, and so what I just want to say is that I think it's not that people are intentionally trying to ration this. It's just that I think there were a series of missteps that occurred, unfortunately. And I'm not here to try to blame anyone, but unfortunately, the U.S. was not prepared with enough tests at the time that we needed. And so we are drastically, as a country, under testing. And so really there is a lot more, and this is really not to raise panic, but I actually think it could be a little bit of a relief. I don't know how people might look at that, but there really is a lot more coronavirus out there in the community than, I know that we keep seeing those numbers tick up every day, but actually, the vast majority that are at home and recovering are not actually getting tested, just simply because we don't have enough tests. It's not about insurance. It's not about, whether or not they went to the right place, but really we just don't have enough tests. And I sense that this is going to change rapidly within the next few weeks. And I think all these restrictions will be completely changed. But unfortunately, this is where we are at as a country right now at this moment.
Yeah, I think what's reassuring about that is it sounds like we know if a patient dies from coronavirus, we definitely know that. But as we test more and more people, we're going to find there's a lot more coronavirus out in the community. And I think what we're going to find is
it's not that bad.
It's probably not going to be that bad
for most people.
So that's kind of a weird, reassuring thing. I think it is important to say that, we shouldn't panic when it turns out there's a large number of people that have coronavirus. I think people should stay calm and not like buy all the toilet paper at Costco.
Yeah, you guys will know. So just expect those numbers to go way up as we now have way more access to testing. And so as you see the numbers just balloon in the next couple of weeks, you could be like, oh, I knew that was going to happen.
Right. And it's not because it's spreading more, it's just because we're testing more. And so I think that's what people have to realize. And because I think what's happening is as the numbers increase, the panic rises, but it's actually just the prevalence of testing.
So next question is from Felicia. What are the causes of death, like pneumonia or something else?
Yeah.
Oh, go ahead.
So I can just say that it's actually surprisingly uncommon to have a concurrent pneumonia with coronavirus. That's a great question, because with influenza, yes, everybody was dying of pneumonia that they got secondary to their influenza, especially during the Spanish flu. And with coronavirus, it's actually quite uncommon. And we do have some data from China that suggests that it's actually just regular old coronavirus, which turns into an acute respiratory distress syndrome.
But those are those folks that are usually, as we had said, elderly or having acute or chronic medical conditions that's what's happening. And that, is what often happens to those with severe viral illness, as Dr. Bymaster mentioned.
Okay, and then Mason asked, what else is affected besides the lungs?
Yeah, so it's mostly the lungs. We are finding the virus in other places, blood and stool being two of them, but we're not seeing dysfunction in other places. I don't know if Tom wants to weigh in on this one, or Cheryl.
Yeah, it's predominantly a respiratory pathogen. And a lot of the symptoms that people experience are the body's immune system trying to fight the infection, fevers and body aches and things like that. But like other viruses, it can affect other organs. It affects the bone marrow in the sense of lowering the white blood cell count in some people. There have been instances of cardiomyopathy where the virus can infect the heart. So other organs can be infected, but most people, it's a respiratory illness.
Next question.
So somebody asked about the flu shot.
Okay, yeah, someone was saying, does the flu shot help because it could prevent a kind of concurrent illness with the coronavirus? And the answer is yes, but not for the reason you say. So if you look at Cheryl's original slide about comparing the influenza with coronavirus, the flu shot prevents influenza, which is far more deadly at this point. Not deadly because of it being more virulent, but it's just so much more out there, so much more commonly affecting people. So it causes way more deaths than coronavirus. And so the flu shot is good because it prevents the flu. It doesn't do anything for coronavirus, but it's a great idea.
But I think that if you had the flu, you would likely be more susceptible to the coronavirus because your immune system is weak. And so I always hear from people, well, it didn't work, I still got the flu. But what we do see are that folks that get the flu shot, even if they still get the flu afterwards, they generally get a less severe version of it, or their body's able to fight it off better.
Yeah, and there's a couple of other good reasons to get your flu shot. It's confusing if you do have the flu, and it's going to tax healthcare resources if you have the flu for your doctor. So being immune to the flu is helpful so that we're not seeing so many people who have fevers and coughs. And then another thing, just to promote sleep again, people who sleep, their antibody response to the flu vaccine is about 50% higher. So your immune system responds better to vaccination if you have a good night's sleep.
Okay, so the next question is about, okay. Oh, May asked where I could find out about vaccines that are in clinical trials. So I posted the CMDA podcast that talks about that. I don't know if you know where else to find that.
You probably can't get the vaccine that's in clinical trials right now. There's a whole process that the FDA has people go through that involves giving it to different levels of people based on their need, and especially with something so new, there's just it's complicated. But eventually, and hopefully soon, we will have a vaccine.
Okay, would those who have asthmatic conditions need to use inhalers on a regular basis? Would they be in a higher risk category?
I would say at this point, it's really about the age, I think, is really the huge factor that is really in high risk. Now, I think that anybody that has conditions such as diabetes or cancer that can affect your immune system, those will put you at more risk to get the disease. And then I think if you were to get the disease and you had asthma, I think asthmatics do have a longer course of illness for any upper respiratory infection. I don't know how other folks might want to answer that, though.
Yeah, I would just say use your inhaler if you have symptoms. And if you don't have symptoms, using an inhaler more than usual probably won't help and may actually make things worse, given that most inhalers that people with asthma have are either like an albuterol type inhaler, which will just make you jittery and uncomfortable. And if you have a steroid type inhaler, we don't want to lower the immune system by using too much steroid in the setting of coronavirus.
Somebody asked about what if you're working in an outpatient clinic and you're worried about bringing a gift home to your family. So I can speak about that as the husband of a doctor. So my lovely wife has brought home bed bugs on multiple occasions.
Ringworm.
Ringworm. Yeah, that was a fun one. Oh, lice. That can be entertaining. So we have had all kinds of scourges.
As well as many respiratory illnesses.
Yes, thank you.
You're welcome.
Do you have any advice for her, or just?
We're terrible at it, apparently, because we bring them home. So
yeah, maybe one of you guys should answer this.
You know, I think part of me is a little reassured, as we talked about, that it's more in the community than we realize. You know, it's funny, the children are actually not getting sick. There are no deaths under the age of 9. And so actually I told the children may be vectors, meaning that they may be the spread of illness. I think if you're particularly concerned, I think one intervention could be when you get home, you take a shower or you change your clothes or you make sure you have a really good hand washing when you hit the door. So that's probably what I would say.
Yeah, I do that anyway, even when coronavirus isn't around. When I leave the office, I have hand sanitizer in my car so that my hands are clean when I come home if I touch anything. And then I decontaminate when I get home. I take a shower and change my clothes right away.
Okay, Rosa asked if pregnant women are considered high risk for coronavirus.
So I have seen a lot of stuff coming out recently about pregnancy, and what I'm seeing so far is that people are very interested in this population and they want to know, and that people aren't really sure yet. We do know that pregnancy is definitely a special condition, and there are some concerns about immune system being different in a pregnant person, and that, you know, we just want to treat them with extra special care. But I haven't seen a whole lot of data. It's, you know, I think it's just early.
I will say that we, in China, there were reports of pregnant women with coronavirus who had babies. And it was good to know that coronavirus did not spread to the newborn. And so, you know, is not an in utero spread. And so that confirms more of that respiratory illness piece.
So Tim said that there's a lot of local tech companies that are asking people to work from home. What are your thoughts on that? So, you know, personally, I really appreciate that because traffic is better. So if everybody just wants to stay home, that's fine with me. Not really. So is that, like, you know, for young people, is that really required, or is that unnecessary panic, or like, what do you think?
I think it makes a lot of sense if you're sick. So if you have a runny nose or a cough or a fever, it's a really good way to not spread whatever it is you have, whether it's influenza or rhinovirus or coronavirus or whatever. As a general preventative measure of just asymptomatic people staying home, I don't think it's necessary. I don't think it's supported by the CDC or the WHO at this point in our country. So I would say it's a good idea if you're sick, but if you're not sick, it's not really necessary.
Yeah, in my opinion, it's a little weird that we're having all these people who are young and asymptomatic stay home, and yet the kids are going to school and we aren't testing people who actually have fevers and coughs in the community. So the whole, the way that we're going about this is very odd, but you know, I think we need to make up our mind. Are we going to really test and quarantine and take it super seriously, or are we going to just go on with business as usual?
Right. I think all this talk about what we call social distancing, you know, I think that really was started, you know, they did that in Wuhan and in China really to prevent or to cause containment of the virus. But I actually think in US that the cat's out of the bag. We're actually past containment. And I don't actually think, you know, I'm not sure this is reassuring to everyone, but I actually think that we're not able to contain at this point because it really is already quite out in the community more than we ever realize.
Yeah, and you know, I want to say for us as Christians, I think it's really important for us to be present and So I think if there's an opportunity, obviously if you're sick, you need to stay home. You don't want to take risks for other people. But if you're able to take a risk for yourself and to be out in the community and be having those conversations, I think the more that we're holed up at home, the less opportunity we have. And I think it's really important to say that we have such a golden opportunity here to share our faith, to say why it is that we have peace, to say why it is that we don't need to stockpile on toilet paper, to say why it is we aren't buying masks because we're more concerned about other people's health than our own. And so I think the more that we can be out in the community having those conversations, it's just such a good opportunity. And I think also supporting the economy. We saw a massive stock market crash yesterday because of panic. And so again, as Christians, I think we can be, forces of positive in a really scary world. And the more we're out, the more we can do that. So I think we answered all of the questions. Yeah, and it's about time for us to end. So I want to thank everybody for taking the time to be on this call. If you're excited about Healing Grove, I want to invite you to get involved. Send me an email if you're interested. Actually, there's one more question.
One more question.
It's okay. Chris, joined late. Chris, we'll talk to you tomorrow about that. Okay. Do we know the point at which a person who contracted COVID-19 is most contagious?
Yes, but you guys might know. Cheryl or Tom?
I don't think anybody knows at this point, but I think what makes the most sense scientifically is when they're having symptoms, because that's when you're sneezing, that's when your nose and your secretions are all over the place and you're wiping and you're getting it all over. So, just like any other viral illness, it's when you got symptoms.
Yeah, so around 5 days, which, that's when your symptoms appear, for 5 days after exposure, almost always. And of course, you don't know when you're exposed, so that doesn't help.
All right, well, if I could ask, let me say one thing. Dr. Angie and Dr. Cheryl will be Healing Grove staff once we get started. And Dr. Angie is stepping down from her job on Thursday, and so she's going to be unpaid Healing Grove staff until Healing Grove starts. So we're definitely looking for people that are interested in supporting Healing Grove. Dr. Stafford is one of our board members and potentially a future Healing Grove staff member if God wills that. So maybe just to finish up, Dr. Stafford, if I could ask you to pray to close us out.
Sure, yeah. Father God, we are thankful that your word tells us that you're sovereign, God, that you are completely sovereign, that there's nothing outside of your control and understanding. We're thankful that your word tells us that you're completely good, and that there's meaning and purpose in our trials. And we are grateful for the opportunity as people who follow you to live walking in your spirit, walking in the truth of who you are, Jesus, in our lives, even in the midst of things that spread fear and panic around us. I pray that we can walk in peace, that the truth of your gospel would go before us, and that we would be lights for you in this time. God, we pray for our world and our country, that this particular virus would not be as bad as some people seem to think, that you would protect and watch over our country and our world, and be guiding your people to share your healing and your truth. We ask these things in Jesus' name. Amen.
Amen. All right, thanks everybody for joining, and we will see you on Saturday at 10 o'clock at Healing Grove to fill the space with prayer.
All right, thanks.
Thanks, guys.